So we have a very important event tonight, and we've got a lot of ground to cover. And we're going to start, please, with a short presentation from the National AIDS Trust on their stigma report. So if I could hand over to Hannah Ward. Hannah, please, the floor is yours.
Thank you very much. Bear with me one moment. You'll hopefully load my presentation. Can everyone see that? Is it coming?
Yeah.
Is it?
Yeah, great.
Yeah. Yeah, I'm not very familiar with Teams and sharing presentations. So anyway, hi everyone. Thanks very much for having us. My name is Hannah Ward. I am Director of Policy and Communications at National AIDS Trust. And just to set the scene really for today, I wanted to share with you some of the key findings of a piece of research that we did earlier this year. We commissioned Britain Thinks to conduct a wide-ranging survey of British public attitudes towards HIV. And we did this through two routes. We surveyed roughly 3,000 people, which has been weighted to be nationally representative and also representative of the devolved nations. So we do have figures for those groups as well. We also conducted 2 exploratory focus groups and 4 deep dive focus groups. So the findings are really a combination of what we found empirically and what we found from that more qualitative research. And what we did find is that the public is quite confused about HIV overall, I think. Knowledge was patchy across the UK, and a knowledge of some of the really key issues that quite often underlie HIV stigma is poor. So, for example, we asked people how they thought HIV was passed on, and whilst most people in fact could identify the 3 correct routes, many also identified incorrect routes. We also found that public awareness of U equals U is low, with most people thinking that it isn't possible that effective treatment prevents transmission. Sorry, bear with me a second. We found that PrEP is also, awareness of PrEP is also low, and that only 1/4 of people believe that there's medicine available that will stop them acquiring HIV. So we tested levels of stigma both through the quantitative polling and through focus groups. We wanted to find out what people thought of stigma, as well as the views that they hold that might contribute to stigma. And so what we found was that only around 1/3 of the public say they have sympathy for all people living with HIV, regardless of how they acquired it. And just 1/3 said it would definitely not negatively impact a relationship with a family member who was living with HIV. By the way, I'm just giving you the bare bones of the research, and hopefully the panel will go into some of the sort of whys and wherefores of this in more detail. We also found that over half of the public believe that people are likely to feel ashamed about living with HIV, and there's some breakdown amongst the different participants here. And sadly, we found that most of the public say that they would be uncomfortable having a sexual relationship with someone living with HIV. When we talked to people in focus groups, we asked them why they thought that stigma was, and we found that they reported 3 main themes. One was that acquiring HIV was related to irresponsible or taboo behaviour, such as promiscuity or condomless sex. The other was that that people didn't know enough about HIV, and that this lack of knowledge would contribute to stigma. And then the third was that they felt that negative attitudes towards LGBT people would be behind it as well. So not the most positive picture, but there are reasons for optimism, and I think, you know, obviously action is needed. So we found from speaking to people in focus groups that information really was key, and all focus group participants received the information that we shared with them in that environment very positively. They found information about transmission that was new, new and very useful, and it went some way to addressing some of their concerns. We also found that that this information helped to address some of their discomfort around having a sexual relationship with someone living with HIV. We found that the public did agree that, in fact, you know, and overwhelmingly so, that people living with HIV deserve the same support as that which is given to those living with other long-term health conditions. And this is fairly crucial, I think, as well for our discussion today. There's high support for public policies aimed at prevention and treatment of HIV, and some of these include, you know, vast majority of the public support healthcare workers receiving better training. They support better relationships and sex education, in which HIV is discussed. They support wider testing, and this is categorical. And they do also believe that the government should do a public information campaign on HIV aimed at the general public to educate people about what it is to live with HIV today. So yeah, that's it from me. The report's obviously available on our website. I'm happy to take any questions later on, but I'll hand over to the panel.
Good. Thank you very much. As you say, we'll have questions as part of all this as we go along. Although I'm bound to ask just very briefly, could you just tell us, is this what you expected? You're on mute.
You're on mute.
Thanks, sorry. Yeah, I think we suspected this to be the case. I'm not, to be honest, because I wasn't at National AIDS Trust when at the time of the polling being conducted. I wasn't there for the original discussions, but I think there is a sense that knowledge is patchy, and I think we did have a sense that outside of you know, those in the know, that people might not really be that aware. And one of the other things that we found was that that most people hadn't really heard about HIV, that there wasn't much in the media or in public discourse about it. And when our focus groups, they reported that if they thought if it was more if it was talked about more, then that would go some way to addressing some of the stigma.
Okay, thanks, Hannah. So we're going to move on now to the first of our panel discussions. And I'm going to ask part of each of our stellar lineup of speakers to answer the question if they can. I'm sorry, in about between 2 and 2.5 minutes. Forgive me, that's just a division happening in the Lords, but I will turn it off in a moment. So the first question is, what is HIV stigma and how does it affect people living with HIV? And I wonder, Mark, could you kick us off?
Thank you very much, Lord Black, and thank you, Hannah, for that presentation. I think it could provide some really helpful background, and I think it's important to say that that actually it isn't something that's a surprise. We know that HIV-related stigma is very much alive and well. My name is Mark Santos. I'm the Executive Director at Positive East. We're a HIV charity based in Stepney in East London. And I think the best way I can respond to that question is by just giving 2 real life examples from people that we've supported at Positive East, anonymised, of course. The first is Jack. Jack presented to us as homeless. And when he did, we supported him to be able to access housing through a local authority under the homelessness legislation. The local authority placed Jack in temporary accommodation, which was a shared facility, so sharing with other folk. And the council officer that worked with Jack said to him that he needed to tell everyone in that property that he was HIV positive because of health and safety reasons, and if he didn't, that the council officer would actually share Jack's HIV status with all the people, because that was the council's policy. Jack said to us that in that moment he felt humiliated, he felt powerless, and it's almost as though his agency had been taken away. Fortunately, Jack came back to us, and we supported him to push back quite strongly with that council officer. Surprisingly, it wasn't the policy of the council, and the council officer was taken to task, and we were able to, and we undertook some training with the housing department in that borough. The second is example is a woman called Miriam, and Miriam was in an abusive relationship. Her abusive partner was abusing her, shared the fact that he was HIV positive. This prompted Miriam to go and have a HIV test, and she discovered she was HIV positive too. The abuse in the relationship continued, and Miriam, with her children, managed to flee the property. As an act of revenge, the ex-partner shared her HIV status with all her family and friends, and she was shunned and became socially withdrawn. She actually left the part of London she was living in and moved to another part, became depressed, had high anxiety levels. She came in contact with us. We helped her, supported her to contact the police to be able to address the issues in relation to her now ex-partner, and she also accessed our specialist psychology service, Reassure, to be able to deal with issues around her depression and anxiety, and to build her self-esteem, confidence, and assertiveness. As I said, these are real life stories. They're not unique, and shockingly, they're not something that happened 10 or 20 years ago. They are things that happened over the last year, and are real life stories of how HIV stigma manifests in the lives of people living with HIV.
Thank you very much, Mark. And of course, it is the real life stories that bring this particular subject very much to life. So very grateful for that. Could I now ask Joe Josh to give us a view on the question?
Well, thank you very much, Lord Black. And I am a real life story, because I'm a woman who is living with HIV. I'm a communications consultant, and I'm involved with this session today because of my role on the steering group of the UK Community Advisory Board, or UCAB, which is a network of 700 treatment activists from around 100 organisations across the country. And I'm going to try to channel some of the things that people have said to me, as well, of course, as my own experiences. And stigma does affect everybody living with HIV, but in different ways. But it does affect all of us. We may be alive and well because of the treatment, but unfortunately, so is the stigma that we're frequently greeted with. It's because of the negative associations inbuilt in HIV. As NAT's research highlighted, it is perceived that you have HIV because of irresponsible or taboo behavior. It's your fault. If you had COVID, it will be because you breathed the wrong bit of breath in the wrong place. If you have HIV, you actually did something. And if you tell people you're HIV positive, or they find out, you can see in their eyes that they are sort of reassessing you, and not in a good way. Was it the result of contaminated blood transfusion? Good, HIV, you're a good person, wasn't your fault. Or do you inject drugs? Was one of your partners or your husband? Or did you just have too much sex? Is that how you got HIV? And when I give talks about living with HIV, I always point out that just as you can get pregnant from one sexual act, you can get HIV from just one sexual act too. I was actually asked to leave a pub, my local unfortunately, because someone overheard me talking about HIV to a friend. And with the loud, "We don't want your sort in here," I was asked to leave. I would love to tell you that I argued and I stood my corner, but I didn't. I was incredibly upset. I've got really good friends who haven't told their family members they have HIV because their family members would react negatively. I've got lots of good female friends who wouldn't, as I do, speak publicly because they cannot about living with HIV for fear of what might happen, what their children might encounter at school. Luckily, mine is now old enough to speak for herself, and her generation, she's 30, I think have less negative attitudes than some older people do. But it's pretty important that we do change public attitudes.
Thank you very much for a powerful presentation there. Darren from the George House Trust, over to you.
Evening all, my name's Darren Knight. I'm from George House Trust up in sunny Manchester, which is a nice change. Hopefully that'll last for a few more days. Nice to see you all this evening. Thank you for everybody who's spoken so far. We run the risk of all fiercely agreeing with each other on this, and I think listening to Mark giving those real life examples, it echoes with what we hear at George House Trust as well. It's ever present, and Joe, of course, sharing your personal experience then was really helpful. But I think for me, I just wanted to kind of make sure that we're all clear that we're talking about the same thing when we talk about stigma. We're in a safe space, safe company with people who get it, and we kind of need to take this to a much wider audience, to people who don't. And I think that stigma as a word is both dramatically powerful and totally meaningless, depending on where you are and where you sit on this. And I think we really need to be clear about, we're talking about HIV stigma, and that what we're talking about is fear. We're talking about shame. We're talking about hate. We're talking about discrimination. We're talking about homophobia. We're talking about racism. That's what we're talking about when we look at HIV stigma, and we're looking at how that's been compounded for many, many years. And I think when we then look at how it kind of affects people, it really kind of brings to life the presentation from Hannah as well, that it's about access to support and services. So that structural exclusion that is faced in work, in acupuncture settings that we get calls for, you know, in tattooists where we're challenging that, in social networks and attitudes with our families, with our friends, with people sharing our status, that fear, that dread, that kind of support that organisations like George House Trust and many of our partners in the HIV sector support people with on a daily basis. And that really tricky one of the self-stigmatising effect, the stuff that we've kind of held and hold and don't know how to address sometimes, and really struggle with that impacts our mental health. So I think that we've got to challenge a lot. I think for me, what we really need to do is not let people off. I think that we have kind of created a word of tolerance with stigma, and that actually we need to be a little bit more challenging about that being discrimination, and kind of voice that quite vociferously to really kind of tackle stigma so people realise the damage that they're doing. We can't tolerate stigma. That's me.
Bravo. And now our friends from the One Voice Network.
Thank you. And my name is Judy Otti. I do agree with all the panelists, and I'm going to look at it in a different, but highlighting again the issues that have been addressed. And for me, when we look at stigma, HIV stigma, it's very multi-layered, especially depending on the community you're working or serving. And we've found that it involves religion, and for some religions, there's a big conflict between HIV and religion, and how you address that. It has a very negative connotation. Looking at culture, again, there is a negative connotation to HIV in different cultures, and self-stigma is a big one, which is experienced internally, and also the perceived stigma that people experience as well, and front-facing stigma from professionals, from the community, like Joe has mentioned, from services like Mark mentioned. And then we look at other intersects like immigration, like language barriers. And for some, one person, if I go back to an example that Mark gave, who may be homeless and looking for a house, might have immigration issues, might have language barrier issues, might have cultural issues, might have religious issues, and all these intersect. So we really have to look at HIV stigma in a bigger lens, and going back to what Darren has said, and stop simplifying it as something really small. Thank you.
Thank you, Judy, for, again, another very powerful presentation. What I'm intending to do now is actually just go on to the third of our questions, because I think that a lot of this... Hello?
Yeah, you've forgotten Helen.
Helen, sorry. Yes. Helen, please, over to you.
No problem. Thanks, Lord Black. And actually, the reality is, I think all of my colleagues who've spoken before me with the voice from community organisations are the best people to speak about the impact of stigma on individuals. The main piece that I would add, as someone, I should say, who works for a pharmaceutical company, so I'm head of government affairs and global public health at Hiv Healthcare, a company that is 100% focused on HIV and AIDS and developing technologies to support people either at risk of or living with HIV. And I think a really important piece is really to also think about the impact that stigma has on access to testing and treatment services for people living with HIV. There's huge amounts of data that demonstrate that stigma and misunderstanding around HIV prevents people from testing. It prevents people from going and accessing services once they've had a diagnosis, and it stops them and often can result in poor adherence to medication, which could give them the life expectancy of anybody else in the general population, but that can be interrupted as a result of stigma that they face from other people, and that comes across all settings. Could be family and friends, but it also could be within healthcare. So I think the important impact and the damaging impact that stigma also has on an individual's journey living with HIV clinically is also really important for us to think about. Thank you.
Thank you, Helen. Apologies for missing you off. What I'm going to do now is to move on to the third of the questions we have here, because I think a lot of the issues around why is HIV stigma still around were covered by the NAT survey, which I think highlighted the scale of the challenge. And so I'd like to spend a little more time, therefore, on perhaps what is the nub of this, what needs to be done to combat HIV stigma. And Judy, could I ask you to kick off on that for us?
Sure, thank you very much, Lord Black. And I would like to look at it from we have tackled HIV stigma looking at U equals U as a terminology, looking at U equals U as a gateway out. But on reflection, U equals U is focusing more on transmission and relationships, and yet there are other aspects of living well with HIV that are not really being amplified. The fact that you can work in any role, the fact that you live a long life, the fact that you can have healthy children, healthy relationships. If that was also amplified in the public media, then there would not be that negative association with someone living with HIV as being dependent on the health system, not being able to work, a burden to society, an expense to the NHS. I think a lot of focus is put on that and not on the good bits where people are contributing to society, living fulfilling lives, very able-bodied. And I think that's where we need to put a lot more focus on. Thank you.
Thank you, Judy. And back to you, Helen.
Thank you. And I'd love to build actually on Judy's comments, because I think there's a lot that we can do. And there's some very basic things that we can collectively do to drive action. There's some very simple things across the board, across sectors, in every field, in general media, in the healthcare settings. We need to change how HIV is portrayed. We need to change how it's viewed. In terms of imagery, the language that is used to describe HIV, they have been entrenched for a long time in a very negative way. And I think there's some basic, things that we can all collectively work on together to really drive those changes. And that's something that at ViV, we've always wanted to work in partnership with community groups to try and do some of these things. So a couple of examples. In the last 12 months, we've launched 2 programs that really are trying to fight some of those pieces. The first one is the Tackle HIV Campaign, which is a public health education and awareness campaign that we launched in partnership with Gareth Thomas, the Welsh rugby legend, last year, and with charity partner, the Terence Higgins Trust. And really the intent of that is trying to get HIV into everybody's living room again. It's trying to get it to be a topic of conversation in a language that the general public understand, and start and generate and agitate those conversations to happen, and provide education and information for people to know the real facts about living with HIV in 2021. We're also obviously trying to use, Gareth's got huge connectivity within the sports field, which enables us to give a very positive message around what it's really like to live with HIV, and mobilize sports personalities to help support that drive for change in attitudes and belief. A second program that we've run, launched on World AIDS Day, is called HIV in View. This is a partnership with Shutterstock. And that's really where people living with HIV have come forward and said they want to help change the view of HIV. So that is photography and imagery that is publicly and freely available across the globe to change the image, so that it's not just the same images of, emaciated African children or white gay men that are affected by HIV, but it really demonstrates the diversity and is inclusive around the realities and very healthy people living with HIV that we see and hope we continue to see absolutely globally. So I think campaigns like that are really important. We're not there yet. We need boldness and investment across the board to continue to push these. But I think, there's hopefully a couple of examples, but language and imagery, simple but critical.
Thanks so much, Helen. Hannah, can we come back to you? You're on mute. Great.
Yeah, so I think, sorry, would you remind me of the question? I wasn't expecting to be called on in the panel.
Oh, right, sorry.
Right.
What needs to be done to combat HIV stigma? So I suppose it's just, what's your top line?
Top line, well, I think, it is complex, and it intersects with a whole range of other areas of discrimination, and I think, so I don't think we would put forward sort of any don't have a panacea as such, but I think our polling was really clear that education and public information was key, and that, you know, we do know that with, you know, with our focus groups, especially when we shared the information with them, that it went such a long way to addressing people's fears, and we also found that the public, so they have an appetite for this. So I think that's really key, and it's also really key, like, addressing stigma and improving public information is key to the government's stated ambition to end HIV transmissions by 2030 and to improve the quality of life for people living with HIV. So I think for us it would be it's education and information, notwithstanding addressing a whole range of inequalities and other areas that do intersect with stigma around HIV.
Given that you weren't expecting to be asked, that was a very persuasive answer, if you don't mind me saying. Thank you. Joe, could I ask you, what do you think needs to be done to combat HIV stigma?
I think we need a very broad-ranging and a very attention-grabbing campaign, perhaps with more than Gareth for rugby fans in it, if you see what I mean. We live in a clickbait age, and we're on a bit of a sticky wicket if we want to persuade people to care about HIV, in terms of it being a numbers game